everyone. My name is Anise, and I've been a nurse for about 4.5 years. And primarily, I have worked on an orthoneuro floor. And so I wanted to talk to you all today about postoperative complications following joint replacement surgeries. My objectives for you all today are that by the end of the presentation, you all will be able to identify common complications following a joint surgery, discuss common ways of preventing postoperative complications, as well as implementing important nursing assessments in the postoperative patient. Common postoperative complications include wound infections, DVTs, malfunctions of a prosthetic, nerve injury, and blood loss. Wound infections, as you all can tell, are not super pretty. The signs and symptoms of a wound infection include redness and swelling at the incision site, as well as excess drainage. Nursing assessments are looking for those signs and symptoms. If a patient is in their first few days postoperatively, they may have a dressing in place that has not been removed yet, and so we will want to be monitoring the drainage on the dressing itself, as well as any redness that's extending beyond the dressing. If we start to see that, we may want to let the surgeon know just so we can change that dressing and see what's going on underneath. To prevent against wound infections, we're going to be talking about hygiene. Specifically, we're going to be talking about hand hygiene as staff, and we're also going to be educating our patients on hand hygiene as well. We don't want them touching around the incision. We also want to talk about showering and wrapping the incision site before taking a shower so that moisture doesn't get trapped in there and produce bacteria. CHG baths will be performed the day of surgery up until discharge. That helps to kill some of the extra bacteria on our skin, and it just helps to decrease the risk of that bacteria moving into the incision and causing an infection. We also want to talk about managing chronic conditions. Specifically, we want to talk about managing diabetics and their blood sugars. To manage the blood sugars, it helps with wound healing and in turn decreases the risk for infection as well. DVTs are another common complication. The signs and symptoms of DVTs are redness and swelling, as well as tenderness in one of the extremities. If it's hip or knee, primarily it will be in one of the lower extremities, most commonly in the calf muscle area. So as nurses, we're going to be assessing for these signs and symptoms. We're going to be comparing the two extremities. We're going to be comparing the pulses in the extremities. A little bit of swelling postoperatively is normal. However, we want that swelling to go down over a couple days. To prevent against DVTs, we're going to utilize compression. So we're going to be using TED hose in the hospital, and those also will go home with the patient to use. And in the hospital, we will also be using SCDs. We are going to encourage exercise in these patients. We're going to be getting them up the day of surgery, and we're going to be ambulating them as much as they can tolerate. We can also teach foot pumps that they can do in bed to help promote circulation as well. Malfunction of the prosthetic. Typically, patients will know when this happens. It's going to be a dislocation, and most commonly it's following either a fall or, in hip patients, non-compliance with their hip precautions. With these patients, they're not going to be able to stand, they're not going to be able to ambulate. So to prevent against this, we are going to emphasize fall precautions while in the hospital, and we also will be making sure that these patients are going home to a safe environment. We are going to teach hip patients the hip precautions prior to surgery, and we will reinforce these while they're in the hospital, and we will make sure that they understand the hip precautions before going home. Other complications that are not as common include nerve damage. So we're going to be monitoring sensation in the extremities. Blood loss, we will be monitoring labs while they're in the hospital. And allergic reactions are not very common. However, sometimes a patient's body will reject the prosthetic, and that will require further surgery. So in summary, prevention starts early in the preoperative period. As nurses, we're going to carry out a thorough neurovascular assessment However, patient education is key to helping patients prevent against postoperative infections. Here are my references. If you all have any questions or comments, feel free to comment below. Or for my fellow students, feel free to comment on the discussion board. Thank you all for listening.